We definitely get overdoses, multiple throughout the day. It's definitely hard just to see that part of the patient's recovery or their journey is only to see the overdose or only to deal with them maybe when they're not in the right mindset and maybe they're not as appreciative of our help. But we kind of know in emergency nursing that we just get that small glimpse of people's journey, and we can just hope that they continue on and that they lead to recovery eventually.
In March, nurses and doctors at 4 OhioHealth locations started a pilot project to do more for patients with substance use disorder. When high-risk patients seek medical treatment, they and their families are offered naloxone with training on how to use it, along with a resource packet with links to treatment. It's help at their fingertips when they're ready.
So far, 97 patients in our 4 pilot emergency departments have received nasal naloxone spray and patient teaching. So we see it as a great success.
Once we've stabilized them, that's really the best time for potential intervention. I'm a firm believer in the program. I can tell you that I'm not universally agreed with by even my own group. A lot of people in the group feel that this is potentially giving people the freedom to do more and take more opiate and feel safe because they have naloxone there in their home, and that we're potentially contributing to addiction. I disagree with that. I think that any life saved is a life saved, and that it's our job not to be judgmental, not to make moral judgments on these folks, and that potentially saving a life by having naloxone in the home, prevent brain damage, respiratory failure, is the right thing to do.
I feel like it gives family members and loved ones some hope that there's something that they can do for them when they're feeling hopeless and they feel like there's nothing they can do. They have this to maybe feel more safe or secure for their loved one.
Before the pilot program launched, OhioHealth educators did 14 trainings on how to administer naloxone, inviting educators with the Ohio Attorney General's heroin unit to explain Ohio's opioid crisis statewide.
So we've worked very hard in Ohio at the Attorney General's office to help people with solutions to this.
The education really brought out the compassion in the nurses and the staff about providing the product and seeing it as a harm reduction strategy and a way to possibly link our patients to treatment and recovery.
I think we've definitely seen a shift in the attitude towards the naloxone. Our other educator, Pam Huff, she actually gave out some naloxone. It was the second time that the patient had gotten it. But a family member was present, and they were very thankful that we were here and we were able to provide that naloxone the first time to save their child's life. So it is making a difference.
We do experience some fatigue. We have the same people that come in over and over again for the same thing. Some people are getting burnt out on it. Then you have to take a step back and say, if that was happening to your family member or loved one, you would want somebody like us to do the same for you.
Addiction, it does not see race, it does not see socioeconomic status. It basically sees that we have an enormous problem that is worsening, and that I think this program is very important in saving lives. It's very simple.